Employees at several long-term care facilities hit hard by coronavirus had sounded the alarm before the outbreak turned deadly. The workers complained about a lack of masks, improper training, and being forced to return to work despite having tested positive for coronavirus, according to Oregon OSHA records obtained by KGW.
Those essential employees know. They know what they need to keep communities safe, and that's what they want to do.
Melissa Unger, president of SEIU, represents many healthcare workers, including some in nursing homes that have become hotspots for coronavirus. In Oregon, 25 long-term care facilities have 3 or more cases or 1 or more deaths. Oregon OSHA records show the agency was alerted by an employee at healthcare at Foster Creek on March 30th, warning employees lack proper PPE to do their job. Nursing directors suggested for employees to swap their face masks and or use another employee's face mask. Later that week, 5 residents died at the facility. An administrator at healthcare at Foster Creek said the claims are false, adding, "My investigation did not identify anyone who used another employee's mask or swap with another employee." It's not clear if Oregon OSHA shared the worker complaints with health officials. An agency spokesperson said he couldn't comment because it's an ongoing investigation.
I think one of the challenges is how does OSHA have its role and how is it communicating the emergency response and other pieces?
The state records show employees at other facilities also complained before a surge in cases. Health workers at Village Healthcare in Gresham warned about safety conditions on March 30th, 2 days before the facility's first confirmed COVID-19 case. Village Healthcare has since reported 36 confirmed cases and 2 deaths. Employer is exposing employees to potential COVID-19 infection by failing to provide healthcare workers with masks, said the March 30th complaint. In a statement, Village Healthcare explained, quote, "We dispute allegations that we have not provided a safe work environment." Similar safety complaints were also filed against Laurelhurst Village and Country Meadows, both of which were hotspots for coronavirus outbreaks.
We're there day in and day out, 365 days a year.
Tanya Funderburk, who works at a different facility, believes caregivers are best suited to identify problems because they're on the front lines. When they complain, it matters.
Because we're the ones that are out there doing the jobs.
As this pandemic continues to evolve, healthcare workers in long-term care facilities hope their voices will be heard and concerns addressed. Iboshi, KGW News.